Hello, in this video, I will try to answer frequently asked questions about the medication ZOFRAN, which contains the active ingredient Ondansetron. If you find the video helpful, please don't forget to like the video and subscribe to my channel for support. What is ZOFRAN and what is it used for? ZOFRAN contains the active ingredient Ondansetron. It is commonly used to prevent nausea and vomiting caused by chemotherapy, radiation therapy, or surgery. ZOFRAN is available in the following oral dosage forms: 4 mg and 8 mg orally disintegrating tablets, 4 mg 5 ml oral solution, 4 mg, 8 mg and 24 mg oral tablets. Ondansetron is also available in injectable forms. How should ZOFRAN be taken? ZOFRAN is available in tablet, syrup, or injection form. It should be taken as prescribed by your doctor and at the recommended dosage. The tablet form is usually taken with water. The dosage of ZOFRAN varies based on the patient's age, condition, and type of treatment. For adults, the typical dose is 8 mg, but you should follow your doctor's recommendations. ZOFRAN is usually taken before the start of treatment to prevent nausea and vomiting. It should be taken at the times recommended by your doctor, such as before chemotherapy, radiation therapy, or surgery. Who should not take ZOFRAN? ZOFRAN should not be used by individuals who are allergic to Ondansetron or any of its components. It should be used with caution in people with certain heart conditions. Pregnant and breastfeeding women should consult their doctor before use. What you need to know before taking ZOFRAN. Inform your doctor if you are allergic to Ondansetron or any other ingredients in ZOFRAN. Also, let your doctor know about any other allergies you may have. Discuss your medical history with your doctor, especially if you have liver problems, heart conditions, or a history of irregular heartbeat. These conditions may affect how ZOFRAN works in your body. Provide your doctor with a list of all the medications you are currently taking, including prescription, over-the-counter, and herbal products. ZOFRAN can interact with certain medications, particularly those affecting serotonin levels. If you are pregnant, planning to become pregnant, or breastfeeding, talk to your doctor before using ZOFRAN. The medication should be used during pregnancy only if clearly needed. What are the side effects of ZOFRAN? Be aware of possible side effects, including headaches, fatigue, constipation, and, in rare cases, serious allergic reactions. If you experience any side effects, contact your doctor immediately. If you found this video helpful, please like the video and subscribe to my channel to support it. Share your thoughts and experiences about using ZOFRAN in the comments section. Wishing you healthy days.